Acupuncture for years has been shown to be very effective in treating a myriad of different conditions. Today we're going to be using a cold laser to treat acupuncture points for anxiety. Hi, this is Dr. Christensen. Welcome to my office. I received an email the other day from Carl in Arizona, and he says, "I first want to tell you how much I appreciate you making it possible for my wife and I to try to make my body accept a normal treatment for anxiety using cold laser." He goes on to tell how the cold laser in the past year he's been using on the acupuncture points in our manual and achieving great results. One of the things that he's doing, which I think is very clever, is using a timer, and he has a 10-second timer because we're treating each acupuncture point for 10 seconds, and so the timer will beep every 10 seconds, and that signals that he moves on to the next point. Again, once you learn the points that you're going to treat, a treatment really doesn't have to last very long. In fact, it can be very quick. And so, 10 seconds, you're going to treat 6 points, every minute. He also commented that his wife one day set the timer for 1 minute instead of 10 seconds, and he treated the point for about 50 seconds before they realized that it was longer than 10 seconds. And his concern was, oh no, I treated the point for too long. Is there harm? And my response to the question there is no, there's not going to be any harm by over treating a point with cold laser. And in fact, if you could imagine that we're wiping off the surface of your kitchen table, and it takes you 30 seconds to wipe off that table. Is there going to be any harm in spending another 15, 20, or 30 seconds on cleaning that table? No, you pretty much did it the first 30 seconds. And so there's something called the law of diminished returns, meaning that if 30 seconds is adequate, is 60 seconds going to be, even better? And of course, once the table is wiped off and it's clean, another 30 seconds really isn't going to do much more. And so it is with the cold laser. If we treat an acupoint for 10 seconds, is 20 seconds going to be better? Is 2 minutes going to be even better? No, there's that law of diminished returns, meaning that you're not going to get that much more benefit by spending extra time on a point. And so to jump into the cold laser for anxiety and stress. And so in the chart, or in the book on page 45, if you've got the most current edition of my book, there are 1, 2, 3, 4, 5, 6, 7, 8 different points that are treated for anxiety. Those are bilateral points. So whenever you look in the book and you see a point on one side of the body, you need to assume that it's on both sides of the body, because the acupuncture meridians run bilaterally on each side of the body, the exception of course being the conception vessel meridian and the governing vessel, which runs straight midline. And so if you have a CV or a GV on there, those are those midline points, and they're right in the middle, so there's not a point bilaterally. And so when we treat these points, number one, the sequence that we treat the points really doesn't matter. And so what we want to do is we want to find an active acupuncture point. And so starting with the chart here, I'm gonna search for an active acupuncture point on myself, because I assume you'll be doing this treatment on yourself. The first one is gallbladder number 20. It's right at the base of the skull. And what you're going to do is you're just going to poke and push on those points. It's right where the muscles of the upper neck attach to the skull. And if you have a tender spot, and I'm feeling it's a little more tender on the left than on the right, that's going to be an active point. And so on my chart, I usually just circle that point. The next point here is on the hand, large intestine number 4. Again, we push on the point there, and if you can see me pushing on the point Are you zooming in on me? We want to push hard enough that the bed of the nail turns a little bit white. That's how hard we need to push. And so you can see as I push on that point, and then I'm going to do both sides. And in my case, those points are fine. Next, we have the tip of the middle finger, and I'm just going to squeeze that there. I'm going to squeeze that there. Again, an active acupuncture point is going to be tender. And so if the point is tender, I'm going to treat it. If the point is not tender at all, I'm going to pass that one by. Next point, heart number 7, right at the juncture of the wrist as it goes into the hand. Again, pushing on the point there, pushing on the point there, looking for a tender spot. Next we go to the feet. No shoes today. And so the next point is liver number 3. We take the knuckle. If I had a bunion here and it was protruding out, I would drop straight into the groove between the big toe and the second toe, and then go up about an inch. Push on the point there for tenderness. That one was a little bit tender. Push on the point here for tenderness. If you're not exactly sure where the point is, just poke around a little bit in that area, and if you find a tender spot, chances are you're going to be on the right acupuncture point you're looking for. And if you're not, you inadvertently found another acupuncture point to treat. The next point we're going to treat or find is on the outside of the ankle. And again, pushing in there. Again, use your chart. Next one here, kidney number 1. If you look at the sole of the foot, it's right where the ball of the foot ends, right in the center. And so that's kidney number 1. That's where the kidney meridian originates. We push there. We push there. And the last one, stomach number 36, we look at the leg here, and we're going to be pushing kind of, well, here's where it is. It's kind of just below the knee, and you push on the area there. And again, you're gonna search around a little bit. Again, you'll do both sides. And so in using the laser, we simply turn the laser on. It could have either a broad beam or a more narrow beam, and I'm going to narrow it down so it's a little more concentrated. When I put that point, the laser on the acupoint, it's not necessary to hold it away. I just plant it right on the point. And so here's my large intestine number 4. I'm going to treat that for about 10 seconds. Again, if you've got a stopwatch or you've got a timer that you can look at that's going to have the second hands running, you're going to be able to treat that. Then after 10 seconds, again, 10 seconds, 15 seconds, 20 seconds, again, is it critical that you're precise as far as the time? It isn't. I had one on the back of my head here. Again, just holding that right there. I can do the other side. The other question is well, what if I want to treat all the points? Is that going to be okay? And the answer is, of course it is. And so a lot of times when we're looking for an active acupuncture point, we are trying to save time. We're trying to be a little more specific. When I do my allergy work with my patients, I treat all the acupuncture points. So there's 19 acupuncture points that we treat in addition to working down the spine, treating the associated acupuncture points. And so there's no harm in rubbing a point or using the cold laser on a point that isn't active or necessary. And so again, as I go through these points, we're just treating the points. And again, it seems like you're not really doing much, but you are stimulating these acupuncture points. You're balancing the meridians, and we see people benefiting from this all the time. It works very well. Treating the kidney point here. Moving to the liver number 3 point here. Going to the side here. With my leg up here, we'll treat the stomach 36. I'm probably a little shy for 10 seconds, but this is demonstration. The other leg, stomach 36. Kidney 6. Liver number 3. And finally, kidney number 1. And so in about 2 minutes time, I've given myself a cold laser acupuncture treatment for anxiety and stress. It works. And so again, if you're feeling a little anxious, identify those points that are going to be your points. If you don't have the cold laser handy, you can do acupressure. And so you can simply push on that point. You can be doing this at a stoplight. Work some of these acupuncture points. Pushing these two together, pericardial number 9. And so that's the cold laser acupuncture treatment for stress or anxiety. Understand this. This is one avenue of treatment. We also recommend several other things. On my blog, I have an article posted that I wrote on the treatment of depression, anxiety, and insomnia. It's also for chronic pain. It's a mindful perspective, or what I call coming back to Christ. And so it uses the principles of meditation, but rather using an Eastern philosophical anchor, such as saying Om, or something that you may not be so familiar with or comfortable with. We use Christ as our meditative anchor. And so I encourage you to look at that. There will be a link to my blog article in the description. Additionally, we have an herbal remedy that we've put together. It's called Nerve Calm, and so that is another thing, and it's got some wonderful herbs there that will help calm the stress and anxiety. Again, when we want to treat any condition, our goal is results. And so we're not going to rely just on the cold laser, just on the meditation, just on the herbs, just on many of the other things that may be beneficial, but we want to get well. And so I encourage you, give this a try. If you don't have one of our lasers yet, go to our website. They're very inexpensive, very effective. And so again, use the cold laser. I think you'll really be pleased with it. If you enjoy our videos, we encourage you to subscribe and share these with friends. Thank you.